Welcome to A Walk in the Park with Gil, where every other week I invite fascinating people to talk about cities. Sometimes it's about parks, others about walking, riding bicycles, using public transit, or children and elders in cities, public health, the environment, and much more. My name is Gil Penalosa, and I was born in Bogota, Colombia, where as commissioner, I led the design and construction of over 200 parks and took a small program of open streets called Ciclovia and turned it into the world's largest pop-up park with 121 kilometers, 76 miles of car-free streets where people of all ages and backgrounds enjoy the presence of each other as equals. 17 years ago, I created 880 Cities, a non-profit organization based in Toronto, Canada, where I live. Before the pandemic, I had worked in 345 cities in all continents, which is why my master classes now are called Gil in 345 Cities. This bi-weekly webinar is a way of giving back, always free. Invite anyone who cares about cities and people to join us. Your comments and suggestions are always welcome. So I want to start by acknowledging the land we're meeting in is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and is now home to many diverse First Nations, Inuit, Métis, and people from many nations. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I also want to tell you in 2 weeks, the next session is going to be Soft City, building density for everyday life. And our guest is going to be David Sim. David Sim, for many years, he was partner of Gale Architects. Actually, his book is called Soft City, that the introduction is done by Jan Gale. And he will be in 2 weeks. And then 2 weeks after that, we are going to talk about cycling, getting more people riding bicycles more often. And we're going to see some of the best examples from North America. But today, let me stop sharing here. Today, we have an amazing guest. It says Paula on her screen, but it's not Paula. Of course, it's Leah. And she is the executive director of Vision Zero Net. Leah, I've known Leah for many, many years. She was the head of the San Francisco Bicycle Coalition, and she took a small organization of about 1,000 people, and when she left, they had more than 10,000 members, and they were a powerful force. Whenever Leah called the mayor, he answered, and if he was not available, he returned her call. Because she had a very strong organization and she had a very strong voice. And I was very glad to help. She also started open streets in San Francisco and helped people in the municipalities around, like Oakland and Berkeley, to start their own open streets. And at some point she said, how can I have more influence? She realized that too many people were being killed in traffic incidents. All over the world, but including North America. So she went to Sweden, spent a couple of years learning, because that's where Vision Zero began. So that's why I invited Leah, because there's a lot of people talking Vision Zero. Maybe 20 years ago, no one was talking in North America. Now everybody's talking, but very few are actually doing. And of course, nothing happens if you just talk. So she's going to tell us a little bit about how can we move from talking to doing. How can we have, cities like Oslo, last year, they had 0 pedestrians there, 0 cyclists there. And this is not only about walking and cycling, it's about also people in public transit and people in cars. People in cars should also not die in traffic incidents. We should not have anybody die. So as always, we are going to have our guest. She's going to do a presentation. Leah, take your time. People are here from all over the world to listen to you, not to me. So take your time, go over the slides, share all the comments, and then afterwards, people are going to be writing Q&A, and then I'm going to have a dialogue with you based on the questions that people will provide. They will also have the chat, except that we ask them that while you present, we ask people not to use the chat because we want them to concentrate, to focus on what you are presenting. And as soon as you finish, once again, they can go back to the chat. Leah, thank you very much for accepting the invitation and welcome.
Thank you so much, Gil. I can't wait for the discussion. I can't wait to hear from folks. I'm here as much to learn from people on the call as I am to share. I am excited to share, but I really do look forward to the second half in particular. So I'm going to jump in. Let me share my screen.
Yeah, share your screen and also tell us a little bit about yourself. That I just did a very brief introduction, because I like people to introduce themselves a little bit on why is it that you are here.
Sure, yeah, and maybe I'll share a little bit in particular. I did not study planning. I did not study cities in any way. I actually grew up in the suburbs of Florida, a very traditional suburban life. My family drove everywhere, and we lived in a place where not many people walked for everyday activities. And as a kid, that I felt frustrated by that. I used to want to walk or bike to go to a friend's house or to go to the grocery store to pick something up. And it just wasn't really done in our suburban area. And that felt strange to me. And I didn't really know why. But then when I moved to San Francisco out of college, early 20s, I realized, people can walk and bike and take transit and drive, yes, but there were all these other ways to get around. And I loved the density. I loved the accessibility of the city. And that's really what drew me to this field, just that experience. And I started bicycling purely for ease. I mean, it was not a statement about the environment or anything political in my mind about the way cities were built. It really was about ease. I could get places more conveniently and more, on time, more predictably, really, when I was biking. Even more so than transit at the time. We had a pretty not great transit system at the time. So I really started biking and just seeing, wow, this is amazing. You can get where you want to go. You can control, your own direction so easily. And I was seeing all these things in this new city, new to me at the time, seeing all these places in the city I would have never seen and really on the ground. So I loved biking. Eventually fell into the San Francisco Bicycle Coalition as a volunteer and then started working there. As Gil said, I ran the San Francisco Bicycle Coalition for about 13 years and loved it. We had 10,000 members by the end and really were helping make a lot of change. But what brought me to Vision Zero, which I'll talk about next, is really a frustration with not seeing enough progress, knowing that we were fighting hard as advocates. I mean, we were working hard, and that there were some good champions within city government, not all of them, but some good champions, but it wasn't enough. It was like we were chipping away at this wall that was never, ever gonna, kind of come down. And I really realized, and looking at other countries, like Gil said, Oslo now is such a model, looking at places like Sweden and other places around the world, not just Europe, elsewhere too, but really looking and seeing like, okay, it's a paradigm shift. It's not just trying harder. It's not caring more. We really need to fix the foundation of what we're doing here in terms of public space and mobility and choices about safety. So that's really what got me into Vision Zero. And I will share that story now.
Thank you, Leah. And while you are sharing your screen, I'm going to tell people, I told Leah that here we have hundreds of people from dozens of countries. We have about 1/3 of the people are Canadian, about 1/3 are from the US, and the other third is really everywhere, from Turkey, from Kenya, from Denmark. And from the point of view of the profile, we have a lot of planners, but we also have transportation people. We have elected officials. It's very important to invite the elected officials to this series. Also, we have people from all areas, the private sector, the public sector. We have lots of people from public health. This is about public health, mental and physical.
Okay. And let me say, while we're transitioning on that note, Gil, I want to thank you, and I know we'll talk more later, but I want to thank you. I definitely learned from you early on, Honest is one of my mentors in this work, the importance of making sure those political folks are in the room, influencers. Maybe it's the elected official, maybe it's their staff member, maybe it's someone who can influence that elected official or that decision maker, but it's so important. So it's a good thing to think.
Thank you, Leah. You are very kind. And one of the things that I love the most about cars, even though usually I move around walking and cycling and taking transit, but I like the cars have a very small rear view mirror and a very large windshield. So on those things, I ask the participants, don't focus on the past. Oh, this mayor didn't do, this councilor didn't do, this engineer, this whatever. No, it's more about the future. Let's look in the past only as it matters to build a better future. But mostly let's focus on the present and the future. Okay, now your screen is full and everything is working. Go ahead and take your time, go over the slides and inspire us. Because after this, everyone will go and even ask for more because this is doable.
That's right. Thank you, Gail, so much. So yeah, I'm going to talk about Vision Zero, and you all know the goal probably. If you've joined today, you're probably interested. The goal is zero traffic deaths and severe injuries among all road users, not just people walking, it's people driving as well. It's people in transit, people biking and scooting, everyone. And really emphasizing, spending less time about what Vision Zero is and how it is possible. And really hopefully emphasizing that Vision Zero is not just a goal. It is a goal, yes, but it's not just a goal. It's not just a tagline. It's not just a slogan. It is truly a paradigm shift. So how do we shift the paradigm for safety? I'd say I'm seeing some encouraging spots, but not nearly enough. So focusing on both what we're seeing encouraging and what more needs to happen. And I'll share, a lot of my slides do focus on US numbers. I think you all know, unfortunately, the US is one of the worst in terms of, let's say, high income nations in the world, but we're just having terrible years in terms of traffic deaths. We've always been quite poor in this respect, but last year and the year before, strangely during the pandemic, well, maybe not strangely, and we'll talk about that, but surprisingly to me at the time, during the pandemic, traffic deaths have been going up. So looking at last year in the US, more than 46,000 people were killed in preventable crashes, just to kind of set the stage. And I really want to emphasize preventable because that's the whole goal here. I think it's really important that I think we're doing a better job as proponents of safe mobility to drill down and really understand that some people are suffering more than others. This is not an evenly spread problem. It is a problem where some people are suffering more, and we know why, and we can do something about it. So kind of starting with that problem, we know that traffic deaths are a leading cause of youth. This is across the world. That's a global number, but particularly in the US, the stat here, this is how more young people are dying than any other way, other now in the US than gun injuries. So think about that. Between gun deaths, I should say, gun deaths and traffic deaths. What a terrible thing to be vying for that top ranking, so to speak. Also, this is US number, but people walking in low-income communities are far more likely, 3 times more likely to be killed by drivers than in high-income areas. I believe this is also a global number, so not surprising. And we'll talk about, is this the fault of the people living there? No, it's not. We've really made our streets dangerous by design. So what can we do about that? Similarly, people of color in America, we know Black people and Native Americans are far more likely to be killed while walking by drivers than white non-Hispanic Americans. And again, this is really, we know this is based on the way communities have been designed over the years and the racist policies and decisions that have been made. These are terrible things. We need to acknowledge them, but we can change them. So as difficult as these things are, we know we can change them. And then this number, I'm sure folks know, or this general trend, sadly, I'm sure people know that the number of people walking is dramatically increasing. I mean, this number blows me away. 45% more traffic deaths amongst people walking. Again, in the US, this is in the last 9, now it's 10 years. This is crazy. At the same time that we're telling people, hey, get out and be active. We know it's good for your health, both your mental health and your physical health. We know we want you out, enjoying the city, the place you live, and eyes on the street, and being able to frequent local shops and support local businesses. What a great thing this is. And obviously good for the environment to have fewer people driving. And yet more people are dying walking. Again, this is not an accident. This is very much the system that we've designed and that we're perpetuating. So how are we changing that system? And really, this is the kind of theme, is that we get the results we designed for. I think if there's anything I'm learning and most taken with, it's how much we've missed. And by us, I mean, we kind of societally, how much we've missed this point, that we really are getting the results we're designing for, whether it's, literally the physical space. We say, hey, move around in this space. Here's how you get to work and school and to the grocery store and to the park. Yet we design the space and we make it so unsafe, to the physical ways people move, right? If you can see, this vehicle is just heart-wrenching. I think we're all talking a lot about how the driver of this vehicle, no matter how aware and safety-minded they are, they might be the most safety-minded, safe, conscientious driver in the world, and there are those, right? That person still can't see this little guy who looks like he's maybe what, 3 or 4 years old, cannot see him in front of her. So I think we're hearing a lot more and more, or understanding a lot more and more about the dangers that these giant vehicles are causing in just such obvious and tragic ways. So I love this cartoon. What if we don't change it all and something magical just happens? This is the way we've been moving in this space around traffic safety. I shared that number at the beginning, the 46,000 US traffic deaths last year. Well, the year before it was, 1,000 more, a couple hundred more, 1,000 more. It's as if these numbers are as if these deaths are just numbers, right? As if we're just charting a number that goes up and down. Oh, a little better, oh, a little worse, a little better, a little worse. Let's study it. These are people's lives, right? Every single one of those numbers is not a data set, is someone's brother, sister, best friend, college roommate, neighbor, mother, grandmother, right? And yet we've been kind of sitting back and hoping it gets better, hoping that people are just safer and that they do it themselves. Well, that's not working. I think we're all very, very, very clear that is not working. So moving to the more forward-looking, what do we do about it? What can we do about it? What are we starting to do about it? I'm really encouraged, here's the encouraging part, that people are understanding, I think more and more, that we need to shift away from the traditional approach. And let me start by saying, I'm not suggesting that everything about the traditional approach is bad. I think a lot of times I'll sit down with, a traffic engineer or a planner, and they'll say, are you saying that everything we do is bad? No, absolutely not. I truly mean that. That's not the case. And let me say, people care about safety. They've always cared about safety. They've always worked hard on safety. The reality is we've been using kind of a certain set of tools or strategies or a certain mindset in this traditional approach. And I think one of the things Vision Zero can help us do, it's not the only thing that changes, but can help us change the mindset, which then changes the actions and the strategies and the tools and hopefully the results. So I won't go through all these, but I think this is a really helpful, just simple breakdown of kind of some of the differences. So, something as simple as Vision Zero is clearly saying traffic deaths are preventable, right? We're setting that bold, some would say audacious goal of 0 traffic deaths. And people kind of bristle and say, well, is that possible? That's crazy. Well, it's also, one would say it's actually crazy that we've been functioning for so long, definitely the last 100 years, that traffic deaths are inevitable, right? Again, we may not say those words, but when you look at a study, say an analysis that is done for, say, a new highway or new big investment on some transportation issue, there's often this analysis of, how many deaths will there be? How many minutes will be saved for people driving? Can we speed up, quote unquote, speed up people's commute? Well, then what are the downsides to that? It's almost as if these traffic deaths are inevitable, and that's not true. We can design systems, we can run systems, we can set policies where the goal is 0 traffic deaths. Now, even if we don't truly get to 0, if we are like these other countries, places like Sweden, Germany, the UK, where they've had, 75%, 50% improvement of safety, we are going to be doing better, right? And we're always going to be striving towards that 0. But we have to start with that understanding that it can be this way. So a few other pieces I'll mention and talk more about. That second one, Vision Zero does something really different. It integrates human failing in the approach. And that sounds strange, but it's, I think, one of the things that's changed for me the most is this understanding, like, oh, humans will make mistakes. We always will. Hopefully we're educated and we're taught, not to drive drunk, not to run out in a busy, highway out of the blue, not to do this or that. Sure. We want to be safe. Individuals should be safe. We have a lot of important ways to educate people in that way, but that's not enough, because there are always circumstances. There always are, and there always will be. Even with the quote unquote promise of autonomous vehicles, we cannot perfect human behavior. no matter what issue you think about. So really thinking about how do we then integrate in and accept people will make mistakes. How do we then minimize the impacts of those mistakes? Because if somebody can make a mistake and be speeding and it ends up with a fender bender versus a death, we can live with that, right? That is better. If someone breaks an ankle versus a traffic death or a debilitating, injury, that is a better thing. So it's really thinking about, let's not pretend that we can be perfect. We can't. So another piece is really acknowledging that again, these incidents, these crashes, these collisions, and thank you, Gil, of course, very, very clearly and carefully did not call them accidents. Words matter. Words matter because they carry meaning. They send a message. And my entire life, I call them traffic accidents. I'm sure, most people do. That's how we were raised. That's how the media calls it. And, in the news reports and the traffic reports. But this is a really important piece. And I'd say, for anyone on the call who, if this is new to you, this is the one thing I'd really ask you to take away in terms of like a next step, a small step of your own change. Because when we call them accidents, it's not just about a blame. It's not, I'm less worried about, who was at fault in the accident, so to speak. It's more about this sense of inevitability, this sense that we, do not have agency, but we do have agency. We have agency individually in ourselves, but we also have agency as a culture, as a society, as a government. So that's really what we're going to talk about. So let's acknowledge that agency. These are crashes and we can do things about them. They're largely predictable and largely preventable. So when I mention kind of this different way of thinking, this paradigm shift, this is a bit of a wonky way to explain it, but it really helps me think about it. This design or this little diagram was created by a group called the Prevention Institute. They're in Oakland, California, and they're all around public health. They don't specialize in road safety. They do all sorts of public health issues. So they're thinking, like many public health professionals, is how do we think upstream? How do we not only think reactively? Of course, there's some reactive thinking, right? If a pandemic hits, we have to deal with it and we react to the pandemic. How do we make sure people get well? How do we get vaccines out there, et cetera? So that's reacting, right? Well, how do we be proactive? How do we look ahead and think, again, societally look ahead and say, how do we prevent a next thing from coming? Or if it does come, how do we nip it in the bud earlier? Well, in the roadway safety world, we've been very much reactive, right? If people remember, I don't know, as a kid, we had that game, the whack-a-mole, right? The little mole would pop up its head and you would bang it. And then the next one, kind of violent now that I think of it, but we need to move away from the whack-a-mole and towards a more proactive and predictive and preventative strategy with roadway safety. So I really appreciate this diagram that they made, and we're kind of trying to take it on in a roadway safety way. So at the bottom in the yellow, you'll see kind of the bottom rungs, things include promoting community education and strengthening individual knowledge and skills. So again, teaching somebody to drive a car safely, teaching a child to look both ways before they cross the street. Absolutely, we need to do that. No one's suggesting we stop doing that. But we have over-depended on that. We have thought that would be enough, or we put too much pressure on that, frankly, or expected too much from that. Meanwhile, we've not put enough attention at the upper rings, and those are things like influencing policy and legislation, changing organizational practices. So really that's, those are the examples and the things I want to share. Let me be honest, these are harder to get your hands around, right? There's a lot invested in the status quo, society, government, it's hard to change. So I'm not pretending these are easy, but this is where we need to be focusing our attention. And another big piece of this paradigm shift, I think it's related, but I think worth touching on at the beginning here, is for the last century, certainly in the US, I think in many places around the world, and I'm guessing Canada as well, for the last century, there's been this really traditional ease approach to roadway safety. And people have different E's, but one of the common ways is engineering, education, enforcement, and emergency services, right? Like the ambulances and such. So they've been laid out as the critical things, and they're kind of seen as this, flat area. They're all important. Well, I think we're learning that the E's have a place, but they're not all created equal. And we need to be a lot more thoughtful with them. So I'm going to focus a little bit, jumping right in on this, the ease of education and enforcement, and yeah, really pushing back on how we involve them. So you'll see, for instance, the image here on education. There's a little graphic, look out for each other, make eye contact, then go, to an ad campaign from the Colorado Department of Transportation. Again, no, I'm not suggesting that we shouldn't be watching out for each other and ourselves, of course, yes, but that's not enough, right? We're setting up dangerous systems. Again, we get what we design, yet telling people they should be careful, or they should save themselves via eye contact. That's not enough. And then you'll see the ad underneath, or sorry, news report underneath, says 4-year-old struck, killed by a vehicle in DC, was not in the crosswalk, police say. It just breaks my heart to think about, why would a 4-year-old need to keep herself or himself safe? We do, but we need to think about how that system keeps them safe. So this idea of education can come back and kind of bite itself. And it really can lead, when done too much, when dependent on too much, it can lead to victim blaming, which then is just a vicious cycle of more and more unsafe streets, and really looking at the people and the victims as the people who've messed up and almost caused these tragedies, which, this news header is implying. And then enforcement. I think we all know, and I know in the US, for us, it's a very big problem that we have many, many, many examples, too many examples of racialized enforcement. And we see that, we know that traffic stops are the top way, or the leading way, number wise. It's the most common way that people in the US, regular folks, interact with the police, is traffic stops. And we know that people of color, Black people and brown people, are more likely to be stopped, whether they're driving, walking, say, quote unquote, jaywalking, biking, people biking on the sidewalk. These are all places where we see racialized traffic stops. So we know we have problems with education and enforcement. I'm not suggesting we toss them out completely, but they need to be really rethought, right-sized, and made sure that they're really effective. So I'm going to go a little deeper in this, because I feel like it is one of the biggest challenges to the work today. I think there's but there's pushback to say, we're never going to get there because we don't have enough police, or we're never going to get to Vision Zero because we can't have police everywhere, or we're never going to get to Vision Zero because people won't let police do their jobs, kind of depending, what end of the maybe political spectrum you're coming from. But I think that's not the case, but we do need to spend time looking. And this story is one of the worst I've heard. Was in Atlanta, Georgia, where a mother was walking with her son and actually another child, and they were crossing the street to get to a bus stop, to catch the bus. And as I understand, the bus was coming, or they needed to hurry to get the bus. So they ran across the street and they're hit and killed. This woman is charged with the death of her son. Now this is what the stories cover. You dig deeper and you look and you see this was a multi-lane, high-speed arterial with no crosswalk for another mile, and a popular bus stop, or a well-used bus stop. So this woman was literally using the system that was set up, using the bus, trying to get to the bus, doing what people say we should do, walk to the bus, use transit. And yet this tragedy happened largely because of the environment, and we're getting what we designed for. And again, same situation. We know that Black drivers, like I said, are pulled over more often, or searched by the police more often in the US specifically. And partly that is because, and again, people walking, biking, driving while Black, the neighborhoods they live in literally have been underinvested in, or truly disinvested in. We see more speeding freeways touch down in communities of color in the US and in low-income communities. We see fewer sidewalks. We see fewer bike lanes. We see fewer good, safe crossings, like I referenced in that last slide. So the situation, again, in these neighborhoods is built for a certain, dangerous behavior in a way, right? You're not inclined, you're not incentivized to be safe because the environment is not safe. And then you get the double whammy now of being, over policed. So a big part of what we're pushing in Vision Zero is, for all the reasons, how are we investing in safe systems, not more traffic stops? The answer isn't just policing. So we're thinking about what is both effective and equitable. What are the strategies for roadway safety in that way? Because we know we cannot educate or enforce our way out of this problem. So really thinking about pivoting from this ease approach to the safe system approach. And the safe system approach is really what underlies Vision Zero. Vision Zero gets all the attention, and it is a it's obviously a kind of a sexy name, right? Zero. And it's good to get the conversation going. Yeah, zero traffic deaths and severe injuries. And let's talk about it. What's really underneath that is this concept of safe systems. So really thinking about what do we need? We need safe streets and sidewalks and bikeways. We need safe speeds. That's critical. We need safe vehicles. That's a piece we certainly have not spent enough time talking about, right? If our communities are investing more money and good policy in safe streets and speeds, but then we have these vehicles coming in, that are 3 times as big as a vehicle 10 years ago, and the driver can't see over the hood, and this car can go 150 miles per hour down Main Street. Well, we've now negated, in a lot of ways, the safe streets and safe speed. So we need all of that. We need all of that. So the safe vehicles is a big piece of this. And safe people. I want to say no one's suggesting we take, individual behavior out of the equation by any means. We still need to educate, et cetera. But when I think about safe people, and I know this is, again, something that I really learned from Gil early on in my advocacy days. When I think of safe people, I really think about who are the people who can influence the most, right? How are we looking upstream for safe people? Sure, there's, the masses of people, all of us who need to be educated. Well, that's going to take a long time and you do your best there. But really, we should be focusing on that very small percentage of people who has a lot of influence. Those are elected leaders and heads of departments and planners and engineers and the media. How they do things, what they decide, what they talk about, what words they use, even crash, not accident. They influence all the rest of us. So really thinking about people in that upstream way in terms of how you're trying to influence too. So this is a piece I think is really important. And this is a study that was just done last year. And to anyone who says, but we don't know, how could we fix all the streets? There's so many problems. And yes, there are. Let me say, I don't want to pretend there aren't, but there's so many problems. We can never get there. This study was done. I highly recommend checking this out if you haven't. This study was done, I think it was over 10 years. It was over quite a long time frame. And it was looking at thousands of locations across the US. So really, really comprehensive. So it wasn't just a one hit, like one place, hugely comprehensive. And they looked and said, excuse me, one second. Where are people killed while walking in the US? And you see these numbers. Almost all were in multi-lane roads, 3+ lanes. Almost all were situations where people had to cross these multi-lane roads walking. Almost all were higher speeds, 30 miles or higher. So this massive understanding of where the problems are happening and what design the roads are. So we do know what the problem is largely. We do know, and we do know how to fix it. So really it becomes an issue of why aren't we fixing it, right? And I'm going to share, I think a great example here of maybe it's not perfect. I'm sure there's still things that can be done on this street, but really thinking about how are we designing complete streets? How are we making sure that there is dedicated separate space where possible for people walking and biking and real clear understanding and predictability, hopefully lower speeds as well. And I want to touch on lower speeds because it's not just about street design. Yes, that is critical. Related to the street design is the speed, and they're purely related, but really thinking about, we have unconsciously for the last century now been prioritizing speed and convenience, or perceived convenience, I would say, over safety. We do it time after time in decision after decision. We need to be consciously saying, wait a minute, is that decision prioritizing safety or is it prioritizing speed? It can't do both. It really can't. We need to shift the paradigm so that we're prioritizing safety. And if there's any graphic that I really hope people take away, or any set of numbers, I hope it's this one that really is jarring to me, that an average pedestrian, so say someone like me who's healthy and able-bodied, average size, if I'm out walking and I'm hit by an average size vehicle, not a big vehicle, but an average size vehicle, if I'm hit with that vehicle moving at 20 miles per hour, on average, I have a 90% chance of survival. At just 40 miles per hour, that doesn't sound that fast, does it, right? Or, lots of streets are 40 miles per hour. At 40 miles per hour, that changes dramatically. I now have a 90% chance of death. So think about dramatic. Yes.
No, I just want to, since 70% of the people use kilometers, I want to highlight that 20 miles is 30 kilometers. So when we are talking about 30 kilometers or 20 miles maximum speed, it's not just because 20 is plenty sounds nice. Is because look at the huge effect. If it's 20 miles, So it's less than 5% if it's 20 or it's 30 kilometers an hour. Same thing at 40 miles or when it's 50 kilometers an hour. When it's 50 kilometers an hour, it's more than 80%. So sometimes it makes the news. Some guy went over at 110 miles an hour. Well, that is the exception. The majority is this difference. Are we going to allow 20 or 40 or 60? So this is not a technical issue. It's a political issue. The people that set the speed limit can decide what is the likelihood of dying. Are you going to put the street at 40 or at 30 or at 20? Whether it's miles or you put it proportional on kilometers, are you going to put it at 50 or 40 or 30? They say, oh no, we're going from 50 to 40 for now. In the future, we might come down. Well, you're just making a decision. You know the likelihood of dying if it's 50 or the likelihood at 40 or at 30 or at 20. So you are making a decision of who's going to live and who's going to die. So sorry, I was just making the kilometers and also allowing you a breather so that you can have the drink of water. It's fascinating, Leah. Please go on. And we're starting to get a lot of questions. So if you have, we'll wait on the chat. As soon as you are finished, go in the chat. But the questions, if anything comes, please, and we'll try to get as many questions answered as possible. Thanks, Leah.
Thank you, Gil. No, thank you for explaining that. Yeah, and I can't emphasize it enough. I think you said it well, that we know this. This is physics. This is I don't want to say a simple matter. It's not simple, right? The body is a complex thing, but this is a very known thing. So when your community or city designers or state level, regional, whoever's designing your street and whoever's setting the speed limit, they know this as well. They should know this. So they are making a choice. If they're designing a street and if they're setting the speed limit at 50 kilometers per hour, now, if that's, a freeway, highway, and it's only cars moving, there is a different scenario. And really thinking about the scenarios we're talking about, there's people mixing, right? We're in a community where there's people walking and taking transit and bicycling and scooting and driving. We have the choice to make. How are we setting this? What level are we setting the speed? And how are we designing that street? They have to go together. So this is known. And I think this is an area that we've been, as advocates, we've been too shy about, or we've been not bold enough in. So I really, really think this is the future of change and advocacy. And let me say, back to that, how vehicles are made or vehicles are designed and regulated. Why do we have vehicles that can go 150 miles per hour or more kilometers per hour? We need to be forcing government to regulate those vehicles so they cannot move that fast. And that is possible. Again, technology makes that possible today. So there's a lot that can be done in this space. And I want to give credit to New York. I know there's, certainly criticism that everyone could be doing more and they should be doing more, of course. But I think New York is an important example. It is, for the US, it was the first Vision Zero community. And they really came out of the gate pretty quickly with the focus on the right things, I would say. And they've been really very much focusing on managing speed. So they lowered their speed limit citywide. Most cities have a kind of a basic, they call it a prima facie basic speed limit. In New York City, that was 30 miles per hour. And they were able, through a lot of advocating and legislation, to move that down to 25 miles per hour. And they saw real impacts there. They saw real change. Now, that's not all they did. I don't want to pretend that just doing that, lowering speed limit signs, is the difference. They did a lot of promotion and education around that. And then they really doubled down on street design as well. Not everywhere, but they increased their street design changes. And importantly, they added automated speed enforcement, so speed safety cameras near schools. And that has been a really successful program. People are probably seeing in the news, I think it was just last week, they expanded that program to be 24 hours, 7 days a week. It was only school hours. So the huge successes, if you're wondering, please check that out. There's a lot of good data and sharing of how that program has been successful. Now, that said, I don't want to go too far and do that. There's a lot that can be done wrong and badly with cameras. There are ways that they honestly, can be harmful if they're used, just for money making purposes, et cetera. That is not the way we want to do it, right? The goal is to change behavior, to be giving out fewer and fewer tickets, and to certainly be fixing the streets where you have the problems, not just trying to ticket endlessly. That's not the goal. So it's really important, I think, to look at that. And like I said, again, I want to give New York City credit because they were first really thinking about redesigning for complete streets. Their Queens Boulevard, people probably know of this. It was called the Boulevard of Death. It was this, it is, and you see it here before and after, massive, and it's actually gotten better than the after, but the massive roadway is huge number of lanes, huge number of crashes and injuries. It was literally known as the Boulevard of Death. And through their Vision Zero work, I would say they got the political will. What they were doing, that those bike lanes and those wider sidewalk areas and fewer travel lanes and more crosswalks, those were not brand new tools. It's not like those things got invented with Vision Zero, of course not. But I'd say with their mayor's commitment to Vision Zero and a lot of advocacy, most importantly, a lot of advocacy and a lot of pressure, and a lot of groups like Families for Safe Streets and the Advocates Transportation Alternatives pushed and neighbors pushed. They made the changes, they used the design changes, and they had a much safer street. But again, Vision Zero, commitment didn't mean these new things were suddenly appearing. It was about the political will to use them. Another piece that they've done really well, and I think is worth highlighting, is this idea of more systemic changes. So I talked about proactive versus reactive. This idea of, oh, do we wait until there's a serious injury or death to fix this intersection? That's usually how it's done, unfortunately. Well, let's get ahead of that. Let's say, and this is the example here, New York looked and said, oh, wow, we're seeing a preponderance, or we're seeing a disproportionate number of injuries and traffic deaths of people walking in a crosswalk or in an intersection, I'd say it, in an intersection where the motorist is turning left into that street. So not only did they fix the handful where they'd seen the injuries and deaths, they actually stepped back and said, wait a minute, we've got hundreds of this same design across the city. We're going to fix them all, because if this design was a problem here, we can understand it's probably going to be a problem elsewhere. So they went in and they're doing this, slowly. It's not overnight, but they are addressing all the intersections that have that problematic design. So that's a great example, I think, of being proactive and predictive, not waiting for the problem, but to say, oh, this is going to be a problem based on what we're seeing. So they may use different tools. Like here you can see they tightened the turning radius for the car to slow the driver down, so that you see that paint, you see the posts. Really, really cheap way to do it, by the way, and a quick way to do it. So that's a way to tighten that up. In other locations, they prohibited a left turn completely because that's what they thought they needed, or they timed the lights differently. So there may be different strategies, but those strategies exist. Again, it's a matter of how are you approaching it and what are you doing? And I want to give one more example quickly. I know New York gets a lot of attention, but I want to give credit to a place out by me. It's Fremont, California. It's a more suburban city, actually quite suburban. It's about 250,000 people. So it's more of a middle range or middle-sized city. And again, much more suburban in a sprawl way. It's not considered a big city, density, but they committed to Vision Zero. They're not doing everything right, but they are doing a lot right. And they are seeing their traffic deaths go down, and they are really investing in the right, I would say, a lot of the right things. So a lot of redesign. This used to be a two lane on each side road, and they were having a lot of high speeds, a lot of crashes, especially with senior citizens. So they did some really basic things with paint. They did some corner bulb outs. They added the bike lane, and they see slower speeds. They see fewer collisions. So a pretty basic way to do it. They're also retiming lights and lowering speeds where they can. But again, what they're seeing is a lot of changes. Or improvements. I want to jump out. I'm going to wind down now because I really am excited to get to the questions. Another positive piece I'll say is that we are seeing more our U.S. Transportation Secretary Pete Buttigieg and his department for setting the goal of zero traffic deaths in the U.S. and really acknowledging that nobody has to say goodbye to a loved one because of a crash, that we can do this. And they've come out with a roadway strategy that sets the goal of zero and really integrates a lot of this safe systems thinking. I don't want to pretend like it's enough, and it's certainly not, it's not being implemented as robustly and as quickly as we think, but it is a shift in thinking at that highest level. And one other positive is that they're backing up this policy with some funding, not enough, but some funding. But to really highlight, there's a new program called Safe Streets and Roads for All. I won't go into details, but it's $6 billion a year that's available specifically, and the funding calls it out, Vision Zero planning or implementation. So this can go to locals, to regional entities, to tribes, so not to states, but folks on the ground. And it can include things like quick build strategies. This funding recognizes that, hey, we don't want to plan our lives away. Some things do need longer planning. Sure, do it quickly if you can, but let's get things on the ground. These projects that really can make a difference. Let's retake this space for public space, for walking, for safety, like you see in the photos here. So I love that this program can fund these things. And I hope a lot of people will apply for that. And to really come back to where Gil started the conversation, we know this is possible. We know other cities have done it. We know that, as the US's traffic death numbers have gone up and the rates gone up, many, many countries have gone far, far, far down. Even if they're not at zero, they're trending the right direction because they're making the political choices and investing in safety over speed. And we know that Vision Zero is possible. And between the combination of technologies that exist today, to roadway designs, to policy changes, we know that right now, we've done this analysis from other people's studies. We put together other people's analysis to show this, that with tools that exist today, so not some future thing, with tools that exist today that are legal and ready to go, that could be done literally, in the next year, 2 years, 3 years, we know how to prevent 75% of, or 31,000 of the traffic deaths in the US with the tools we have today. So why aren't we doing it? That is really the question we have. And I realize I'm a little more, we know that, looking at other cities that, especially during the COVID time, that we've seen these massive changes, obviously terrible things happening too, but to really look and say, how have places like Brussels and London and Paris really taken this kind of shift or pause in some ways in the way people get around and are doing things to really rethink their public space. It should be encouraging. It should show the potential. And I added this one, especially because I know this is near and dear to Gil's heart, but really coming back to how are we designing our roads? How are we making political decisions, policy decisions about space, streets, roads, parks, sidewalks that belong to all of us when we really think about the movement of those that are most important, that are most precious, our children, our elderly, right? And really think about that. Because in the end, what we're working for, Vision Zero sounds kind of, it is dark and grim in a way of traffic deaths, but really Vision Zero is about more. If we are successful, and as we are successful, it means more. It means more people living for more birthdays, more happiness, more time together. And it really should be that aspirational concept of more that's driving our advocacy. And I will stop there and say thank you so much for the opportunity.
Shouldn't happen. Leah, thank you very, very much for having been our guest, and also thank you for everything that you are doing around the world to try to make streets safe for everyone.
Thank you, Gil. Keep inspiring us. We need you. Thank you so much. Appreciate it. Take care.
Thank you.
Bye,
Bye-bye.
everybody.